And I am very much happy to introduce our speakers today. We are talking about various inequalities, especially health inequities pertaining to the global South. Okay, and we have our two presenters here today. And our first presenter is Odile Mackett, and she's presenting on quality of work and unpaid reproductive labor in the South African labor market. She is a lecturer and PhD candidate at the University of Witwatersrand School of Government. Her PhD focuses on the International Labor Organization's Decent Work Agenda and the implications the traditional framing of work is likely to have for gender equality in the labor market, given the different types of activities men and women engage in on a daily basis. More generally, her research interests include Social Security, which is closely linked to access to the labor market, and the importance this has for poverty and inequality outcomes. Current ongoing projects include an investigation of household composition changes, the effects thereof on labor market attachment, and its implications for the efficacy of South Africa's Social Security programs. Odile is an associate editor for the African Review of Economics and Finance, as well as an associate member of the Pan-African Scientific Research Council. And without further ado, thank you so much for being here, Odile, and I'm very much looking forward to your presentation. So go ahead.
Perfect. Thank you so much, Iris, and thank you so much for the ASE for this opportunity and for inviting us to share this platform with you guys. So I have like a short-ish presentation which I'll just talk to. A lot of it draws from my PhD research, which is currently under examination, so hold thumbs for me. I just want to start my time here so I don't end up talking for like an hour. But basically, the COVID-19 pandemic has reminded us how valuable time is, and we are sort of still in a race against time. So time is of interest to me because it's one of the most equally spread resources we have. And yet we often don't recognize it as a resource. So no one can give us more time and no one can take time away from us. This is the case regardless of how much money you have, but of course not everyone has the same degree of autonomy when deciding how they want to spend their time. So authors in the recently published Routledge Handbook of Feminist Economics very aptly stated, I love this quotation, although I will not attempt to pronounce the names of the authors because they have characters in their names that I've never seen before. But basically, they said that it's on page 277, that time is acknowledged as the universal input necessary for doing anything, and hence the ultimate currency for equality and justice. So years of research on time use surveys have shown that women tend to be disproportionately responsible for work in the household. That is caring for children, the elderly, sick, and others in need. In addition to cooking and cleaning, while men were disproportionately engaged in wage work or work in the labor market. So this became known as the gender division of work. The feminization of the labor force, which was a global phenomenon, saw more women entering the labor force, often at the expense of men's employment, whether it be out of choice or whether it be out of necessity. So according to standard economic models, based on the ability of society to achieve some form of equilibrium, this feminization meant that as women started spending more time in the labor market, they would reduce their time spent on housework, which made sense because you only have 24 hours in a day. So to make up for fewer hours spent by women in the labor market, men would have presumably spent more time helping with care work in the household. Instead, we largely saw women extending their working days to accommodate both their paid work and their unpaid work, or having to outsource this work to someone else and carrying the responsibility of managing such outsourced work. And naturally, most of the workers to which housework became outsourced were also women. In many countries, this housework is outsourced to migrant laborers, known as the global division of labor now, or women from ethnic minority communities, so contributing to the racial division of labor. This arrangement perpetuates the subordination of migrant workers and workers of color in the labor market. In addition to the reproducing women's subordination, as they make up the majority of reproductive laborers. So against this backdrop, many studies on the labor market and inequalities within the market tend to have a market-orientated approach, or alternatively, an approach which only considers what happens to workers in the labor market, like considering their level of education or skills or wages, while ignoring the social and cultural factors which impact the available resources they bring to the labor market, the most notable being time, but others including psychological well-being and other often unobservable variables. Furthermore, traditional economic studies also tend to focus on wage rates and a form of occupational prestige, using this as a proxy for quality of work. In more recent decades, the ILO's Decent Work Index has attempted to merge the various concepts used for describing good work into a single definition of what we might consider good or decent work. In their manual, they include variables like whether someone gets paid vacation leave, whether they belong to a union, and the degree to which employment opportunities are available in the economy under study. And the one thing that I do like about the ILO's Decent Work Framework is that they attempt to sort of merge variables from different disciplines, so from economics, from psychology, from sociology, as far as things are measurable. So my interest in the concept of decent work grew as it was packaged as an aspirational statement. So this meant that there's a degree of acknowledgement that the perfect job does not exist. However, we can strive for occupational standards that are as high as possible. So given that the decent work agenda is an aspirational statement, I felt that it was lacking severely in its degree of aspiration by completely excluding unpaid reproductive labor in their definition of work. The disproportionate time spent on unpaid reproductive labor by women, many feminist economists have argued, is one of the underlying causes of gender inequalities in the labor market. However, if we only consider variables which are related to the mainstream economy or the productive economy, as the decent work agenda does, we risk never achieving any form of gender equality, because inequalities would stem from exogenous variables, which are often not considered in policies related to the labor market. So just to set the scene for my study is set in South Africa, which has one of the highest inequality rates in the world. We consistently compete with Brazil for the #1 spot as the most unequal country in the world. South Africa currently provides social security to the elderly, children, and people with disabilities. In other words, people whom we don't expect to work. These individuals benefit from transfers called social grants, which are paid out to individuals upon passing a means test. For those who are of working age, Social Security is only available to those who have worked before. In other words, they've accumulated some credits and then they can claim that back at a later stage when they are out of work. And so these individuals who've never been formally employed or who've only been employed in the informal sector or have precarious jobs would have no social security cover whatsoever. So it's basically you find work or you fend for yourself. Although South Africa has a very generous social security framework, wage income remains the main source of income for many South African households. And wage income is also the main contributor to the overall inequality rate in South Africa. So this is concerning because according to the latest quarterly labor force survey, which was actually released 2 days ago, it showed that the unemployment rate had increased to 34.9%. Rounded off, it's 35%. In other words, 1 out of every 3 people who wanted to work and who did actually make an effort to look for work in the reference period, which is 4 weeks, could not find a job. Including discouraged work seekers, as in those people who did not make any effort to look for a job, this number increases to 52%. So that's like 1 in every 2 people. And of course, we know not all discouraged work seekers are discouraged because it actually costs money to look for a job. So people sometimes just don't have the resources to do that. And so they then get categorized with the discouraged work seekers. For the youth between the ages of 15 and 24, the official unemployment rate is sitting at 64%. So these are people who made an effort to look for a job, they couldn't find anything. A large proportion of the youth would have never held prior employment and subsequently not be able to benefit from any form of social security. The government has thus failed to support a large segment of the population, and households have been compelled to accommodate these individuals. So the households are essentially carrying the economy at this stage. So with my study, I set out to demonstrate the relationship between time use data and job quality by using time use data. So time use data have become more popular in recent years, rather, particularly amongst feminist economists, as it collects data about the various activities people spend their time on each day, and thus gives a more informative view of activities, including those which are not necessarily considered strictly economic. So although my case study, South Africa, does not have a single nationally representative survey with which I could build a decent work index and study people's time use, I thus had to use the labor force survey and the time use surveys separately and then match them for the survey periods that I was studying. So to build a decent work index, I used the quarterly labor force survey. And some of the variables I included were things like whether someone said they wanted to work longer hours, because that would be an indication of underemployment, for instance. That would, for instance, not be good for decent work. Or what, sorry, let me just see here what the gender pay gap was in the particular sector where that person worked, or whether they had, they contributed to medical aid or to a pension scheme, or whether they had some form of union membership. So for everything that was good, in inverted commas, I gave a score of 1 or something close to 1, and everything that was bad, I gave a score of 0 or something close to 0. So for instance, if you worked in the informal economy, I gave you a 0, whereas if you were employed in the formal economy, I gave you a 1. So I then added up those scores for each individual in the survey. And then I normalize the scores, which would then give each individual a value between 0 and 1. And 0 being then, you literally have the worst job in the economy, 1 being you have the best job in the economy. And I used the 2-digit level occupation groups according to the international classification. And then I ordered them. So I ordered them from the best occupation to the worst occupation. So the thing about the labor force survey and the time use survey is that they use the same occupational structure. So I then carried over that rank to the time use survey. So that's sort of how I matched the two surveys. So using the time use survey, I was then able to investigate the relationship between the rank of the occupation group, so where on the scale you were, which was now a proxy for job quality, and the time spent on unpaid reproductive labor. So this would be labor that you do around the household in your community, but you do not get paid for it. So it's not the work a domestic worker does, for instance, although that may be reproductive labor, it's paid. So it's a paid job. So yeah, I was just looking at unpaid work you do not get remunerated for. So the 2 survey periods my study covered was the year 2000 and 2010, because we only have those 2 waves of the time use survey currently. And between the year 2000 and 2012, the South African government undertook an expansionary fiscal approach, which entailed an increase in employment in the police service, education, and health sector. This direct employment creation was accompanied by an increase in social grant payments, which I spoke about earlier, and indirectly through strengthening the service delivery capacity of local authorities. So the government's stance on public sector employment has a direct bearing on households, both directly in the number of jobs created and indirectly in the capacity to deliver on its public mandate. A lack of public infrastructure severely affects women and girls. So take a lack of running water, for instance. If there's no running water in a household, as in a tap, that water then needs to be fetched. It is often the women or the girls in the household who perform the work of fetching water. They thus need to take time out of their day to perform this labor. So that would add to the number of hours they spend doing unpaid reproductive labor. So fetching water from an external source has also been associated with an increase in illnesses related to waterborne diseases. So if a household member falls ill, it is again the women who spend time caring for such individuals. This time commitment to housework and care responsibilities affect women poorly, as they have a reduced capacity to engage in wage labor, and it also affects girls negatively, as they are more likely to lose out on time spent in school. So public infrastructure investment has a direct bearing on the time use patterns of women and girls. So what I found in my study was that there was a significant relationship between time spent on unpaid reproductive labor and the quality of paid work, although this relationship was only significant for female workers. Furthermore, the study found that this relationship was also only significant when economic and labor market conditions were relatively poor, or when the government reduced public spending or adopted a form of an austerity approach. The relationship between time use and job quality shows that inequality in time use is a key determinant of inequalities in the labor market, and a failure to address these underlying inequalities is likely to render initiatives aimed at reducing gender inequalities in the labor market futile. So where do we go with this in the future? So equalizing time use, especially in the household, is no simple matter. If you regulate household activity as a government, you run the risk of infringing on the civil liberties of individuals, and you could be accused of being a nanny state, which no one wants to be. Although the findings of my study clearly show the effects of an investment in public infrastructure and a capable civil service can make to improving time women have available for wage work and their subsequent job quality. However, in addition to these public sector investments, we need a much more innovative approach which strives to change cultural and social norms in society more broadly. Okay, that's the end. Thanks.
Thank you so much, Odile. We will follow up with a Q&A session for sure shortly, well, after Mathias's presentation. And I have so many questions. Personally, I am doing work as well on occupational prestige, so definitely have a lot of questions for you. And I very much look forward to that Q&A session. But thank you so much. So next we will go with next we will have our other presenter, Mathias Akuoko, who will be presenting on public health issues and health inequalities in the global South with a focus on Ghana. Mathias is an assistant professor of public health and a co-director of the Healthcare Administration program at Austin College. He grew up in Ghana, where he had most of his early education. He received his bachelor's in social sciences. I would try to pronounce this name, Mathias, but I'm not sure I know how to. Okay, in Ghana in 2003, an MPA from Southern Illinois University at Edwardsville, Illinois, and both an MPH and PhD in health management and policy from the University of North Texas Health Science Center in Fort Worth, Texas. Prior to joining Austin College, Mathias worked as an assistant professor of public health at Westchester University in Pennsylvania, and as an adjunct assistant professor of the University of North Texas Health Science Center School of Public Health. His areas of interest are in health disparities and in global health issues, particularly maternal and child health issues in developing countries. With a couple of publications to his name, Mathias is currently working on a number of public health issues, including African immigrants and access to healthcare, and the impact of political and socioeconomic issues on child undernutrition in developing countries. So without further ado, I will turn the time over to Mathias. Thank you so much in advance.
Thank you so much, Iris, for that great introduction. Even though you made it sound more better than I am. I like it. So I will be talking about, I'll be talking on the public health issues and health inequalities. And broadly, I will be discussing issues from the Sub-Saharan African region with specific examples from Ghana. So that's how I'm going to plan my talk or presentation. So to start with, we all know that many factors create inequalities and public health issues in the global South, especially if you look into the Sub-Saharan African region. These factors are multifactorial, meaning that they're ranging from economic issues, social issues, religious issues, cultural issues, environmental issues. All these things come together to create these public health issues and health inequalities in this part of the global South. I mean, by in this part, I mean Sub-Saharan African region. Okay. But for the purpose of this presentation or this talk and looking at the multifactorial nature of the factors that contribute to inequalities and public health issues in the Global South, I will limit these factors to three main, which cut across most of the issues, most of the other factors that also affect or impact public health. And these three factors, broad factors, are what? Education, income, funding, and access to healthcare issues. So first, let me start with education. For most in Sub-Saharan Africa, education is the foundation to a good job. Just like it is in the United States and other parts of the world, the more you're educated, the more you stand the chance of having a good job and therefore being able to earn a good income, be able to support yourself and to support your families. But if you look into Sub-Saharan African region and, for instance, in Ghana, it is even in a different step altogether. In the first place, the jobs or the employment opportunities are not there. The few ones that are there, people have to be highly educated to be able to compete with the jobs that are available. So in most cases, the jobs that are available that people are competing for may not commensurate or may not even align with the kind of educational achievements that people use to apply for those level of jobs. Even that aside, unfortunately, the education, or this type of education, is not a type of education that leads to innovation and entrepreneurship in the region. They focus mostly on reading and writing. And that has been one of the main issues that is confronting the region, because education does not give people the skills or the needed opportunity or the skills to be able to come up with innovative ideas to address some of the problems that confront them. But even with this level of education, many do not have access. And this forms the foundation of what some of the inequalities in most aspects of people's life. So in many parts of the Sub-Saharan African, your place of residence, it can be likened to what you have in the United States. For instance, the district or your city, your school district determines if it is good, then it means you're going to a good district school. If it is not a great, then it means that you don't have a good or a great school. In Sub-Saharan Africa, it's rather different. Here, it is whether you live in a major city versus whether you live in a rural community or underserved community. And even within the major city, it is about whether you have the resources to send your children to schools that have the resources and that have the facilities to train your child to compete for the few, let's say, jobs or the few opportunities that are available. Again, where you go to school also determines whether you have access or you may be able to progress beyond primary and secondary education. So take Ghana, for instance. For you to go to university, you can't just go to any secondary school or any primary school. There are few schools that are able to make it from high school to the university because the universities are not available in abundance. Many people have to struggle for the few spots that are available. So if you go to our major universities in Ghana, you can count the number of schools that are represented in these institutions. And those things begin to set that foundation for that inequalities because some people were not able to compete right from the get-go. And if you're not able to compete right from the get-go, it creates a problem. And so many people in rural and underserved communities are cut off from the relatively good education that one can find in the major cities. So if you go to these rural communities or underserved communities, they have poor to non-existent infrastructures in these communities. Some kids have to walk several miles to go to school and after school. And even on top of that, places do not have infrastructures and teachers do not want to be posted there to go and teach in these areas. So in this era where many people find the information, communicate, interact with people on social media, some of these rural and deprived communities do not have electricity, they don't have potable water, they don't have internet, they don't have transportation. Pretty much they are disconnected from the real world. So the average person would not like to go and even teach there. Okay. And on top of all these problems, there's also the problem with the girl-child education. Okay. I mean, for so many reasons, but a few of them include what? Cultural preferences, I mean, inadequate financial resources, and also competing domestic demands for girl-child education, for the girl child. And Odile made mention about, I mean, children and women having to go fetch water and having to do all these things. It is interesting to know that in some of these communities, domestic activities are competing for the time of the girl child, meaning that if the girl child is needed to perform some of these domestic activities in the home, there's no way family are going to send her to school. Similarly, I mean, if the financial resources are not available, families will send their girl child to school, sorry, their male child to school, because they see that as more important to them than the girl child. So even in Ghana, where K through 12 education are free at no cost to any person, girls have to cross significant cultural barriers, to be able to get into the education thing. And on public health and health education, one thing that we see in the Sub-Saharan African region is that public health education is not inculcated in our primary education. Okay, so this creates an uneducated population who falls prey to herbal and quack doctors. Okay, then the level of education of the masses coming. So a typical example is a perception around COVID vaccine that we have these days. I mean, many people are just going around with the fact that they have a cure for COVID, they have a cure for tuberculosis, they have a cure for hepatitis B, they have a cure for HIV/AIDS. I mean, it all boils down to the fact that most of the people are not educated on some of these public health issues that confront people. Okay, and again, from the population's point of view, the education system in these countries south of the Sahara do not provide the skills needed for people to innovate, to be able to create opportunities, to use economic resources that are available to them to advance the development of these regions. Okay, so I mean, Sub-Saharan African countries train a lot of biomedical engineers, but these biomedical engineers do not create any new equipment. We buy them from across the world. Okay. And because they are not able to put some of this education into invention, I mean, most of these countries do not have any say at the table. Sub-Saharan African region is one of the biggest consumer of vaccines, but little production of vaccines in the region. So all these create, various levels of inequalities in the Sub-Saharan African region. So right from the beginning, education set a foundation for inequalities between those that are living in the urban centers versus those that are living in the rural areas, between boys and girls, between those that have the financial resources and those that do not have the financial resources. For those in the global south, especially in Sub-Saharan African countries, education is one of the main foundations of healthcare inequalities, simply because education translates into poor access to socioeconomic resources. And it leads to a wide range of health inequalities, as I mentioned, between the haves and the have-nots, between those in rural versus those in urban areas, between men and women. Okay, so that is a part on education. The second part is economic issues or funding issues. And for the funding issues, I will talk about it at the individual level and also at the population level. The deal is, if you have the resources as an individual, you have access to good education and you have access to good health. Okay, this is in Sub-Saharan African region. Okay, once socioeconomic resources determine when, where, and how that individual receive healthcare. So as I said, if you have the resources, you have access to prompt and good healthcare services. If you have the resources, you have access to good hospitals and good specialists. Without money, without the financial resources, one is not guaranteed the right type of treatment. So take Ghana, for instance. Ghana has a national health insurance system whereby maternal and child health issues are completely free. But even on top of it, Okay, when you go, you have to put money down before you'll be cared for. Most hospitals do not even want to take that type of insurance simply because the reimbursement is very low, and it takes forever for the government to even get you your reimbursements. Okay, so this creates a lot of problem between the haves and the have-nots, or between the rich and the poor. Okay, and at times providers may even want to know your socioeconomic status before they even prescribe a treatment for you. And I'm just giving this example because it happened to my grandmother just early this year. Okay, the physician has to ask who is going to pay for the medication that he was prescribing for her. Okay, before he prescribed the medicine for her. If she doesn't have the financial resources to purchase them, then he was going to give her something that he think she could afford. Okay, the question is, would I be able to address the problem that took her to the hospital or not? That is the issue. Okay, so when it comes to economic and funding issues, since those in deprived communities are mostly less educated and have less financial resources, they face major constraints when it comes to healthcare issues. So access due to financial problems. Okay, so sometimes simple and minor healthcare needs are postponed simply because one cannot afford the basic of healthcare services that they need. Okay, and it will interest some of you that if you go to in some sub-Saharan African countries, even gloves that nurses and midwives and physicians have to wear to take care of these people, a patient has to buy them. Okay, a patient has to go and buy them, sometimes from the pharmacy shop or the drugstore, and bring it to these nurses for them to use to take care of this of the patient. Okay, and on top of it, there's also an access issue due to a geographic location, where people are far away from where these centers are. Now, just that's at the individual level. Now, at the population level, if you look at investments into public health and healthcare issues in the sub-Saharan African region, you realize that, it's ranging from what? Very small to zero, almost zero, in terms of what? GDP, percentage of GDP that goes into public health and healthcare infrastructures. In most cases, public health issues are just, not a primary issue for most of these countries. So small investment in public health and healthcare infrastructures. Okay, and there's also the issue of what? Research funding. We spend very little when it comes to what? Research funding. Okay, and if you look at public health institutions or healthcare institutions in the sub-Saharan African region, most of them depend on foreign donations, foreign donors for research. So the foreign donors dictate the research, and therefore the answers and the outcome leading to what? Inequality. So in most of the time, some of these research that are being conducted in these communities themselves do not address major issues that confront these communities that they are supposed to address. So in most countries across the global south, as I mentioned, the sub-Saharan African region, the combination of education, socioeconomic factors or funding issues significantly affect health and public health issues. And they create this sense of what? Inequality between those that are educated and those that that are not educated. Between those that have the financial resources to be able to afford healthcare services and those that do not have the financial resources to be able to afford. And of course, between men and women. Okay, most of the time when we talk about some of these issues, we lump them together. But if you go into details, you realize that women who are the primary caretakers of most of the families are deprived most of these major or important healthcare services that they need in their lives and for their families. One thing that public health is very much important, and is that if women's health are not prioritized, that's going to affect the whole health of a community and the whole health of society. But if you look into the sub-Saharan African region, right from the get-go, girls' health or women's health are not a major priority. And that have created multitude of what problems, healthcare issues, creating a sick society and not a very well productive society. Now, let me go into the third component, and that is access to healthcare issues. Okay, so the education as a factor, funding or economic issues as a factor combine to create whether one will have access to healthcare services. So as you all know, and just like anywhere in this world, access to healthcare, it's affected by what? Financial factors. If you have the resources able to, geographic factors, distance to clinics, distance to hospitals, and of course, your level of education. Okay, so at the population level, in most of Southern African countries, we have inadequate of medical institutions or public health institutions. Okay, lack of healthcare infrastructures. We do not have them. Sometimes people have to travel miles, hours to get to the nearest healthcare center. We are talking about needed healthcare services. For instance, when a woman is in labor, okay, they have to travel hours, not in a car, sometimes on foot, or sometimes being carried by other people to get to some of these places to get healthcare. So lack of access to healthcare and also infrastructures also explains why there's a wide range of what migration of healthcare workers out of the country. Okay, if you look at it, even though I didn't go into the medical field, there are some of my mates that went into medical field, and I can say that about 30 to 40% of them have migrated out of Ghana and serve in other parts of the world. Okay, this is creating a high rate of what brain drain of healthcare professionals in these regions. Okay, so a typical example is that if you look into, there was an article that explained some of these brain drains in terms of hospitals, physicians that are migrating from the Sub-Saharan African region. So in the United States, for instance, as of 2011, there were close to 11,000 physicians. Exactly to be precise, was 10,377 physicians that had migrated from Sub-Saharan African region and serving in hospitals across the United States. Okay, and this 10,377 physicians, this number exceeds the total number of physicians in Ethiopia, Ghana, Liberia, Tanzania, Uganda, Zambia, Zimbabwe, these countries combined together. Okay, so we are talking about physicians that have migrated from this region to serve and are serving in hospitals and clinics across the United States. They are more than 6, almost 7 countries in the Sub-Saharan African countries combined. Okay, so this creates a whole lot of what problems with high physician to patient ratio. Okay, currently in the United States, it's about 2.6 physicians to per 1,000 persons. But if you look at countries like Nigeria, it is 0.3 physicians per 1,000 persons. In a country like Liberia, it is 0.1 physician per 1,000 persons. And in Sierra Leone and Liberia, Ethiopia and Liberia also, no, Liberia is a 0.2, 1.1. In Sierra Leone, Ethiopia and some other Eastern African countries is 0.2 physicians per 1,000 population. Okay, so it takes longer for one to schedule to see a physician and to get other services like MRI and other things that we take for granted here. So for instance, in the United States, it may take you a couple of days to schedule to see a physician or for MRI or any of these things. In the UK, probably a couple of weeks. But in Ghana, or specifically most other, parts of Sub-Saharan African countries, you're not going to get it if you don't have the ability to pay for it, or they are not even available to it. So lack of access to economic resources create disparities in health and health outcomes. And most of the time, women and children are the ones that take the brunt of these because they mostly lack access to healthcare throughout their life cycle. So these set the foundation for health inequalities in these regions. For the sake of time, let me talk about a little bit of current public health issues that confront the region. And then we'll open up for maybe question and answers. One of the main issues, current public health issues, is maternal and child health issues. Okay, it is a major issue confronting the sub-Saharan African region. I mean, as I mentioned, maternal and child health are not a major priority. Okay, the region, I mean, countries do not invest money or resources into this. And coupled with poor education or, I mean, economic issues, many people rely on improving methods of care. Because they don't have access to it, people have to rely on quack doctors with questionable and improving approaches to healthcare for their daily healthcare needs. There's also over-reliance on self-medication. Okay, in the United States, for you to get any medicine, you need a prescription from a physician to be able to get some of these things. But in most parts of Sub-Saharan Africa, even some controlled medication, controlled drugs, you just have to walk into the drugstore or the pharmacy store, just pay money and you get them, you go. So self-medication, I mean, leading to, abuse, and what do you call it, overdoses and all these things happening. Another major public health issue is of inadequate electricity. Okay, we need electricity to be able to refrigerate medicine, the drugs, the vaccines, and all these things. January 2019, we went to Ghana with some students, public health students. We went to these hospitals, clinics in these rural communities. They do not have electricity. Okay. Whole clinic do not have electricity, so they don't have the medications, they don't have anything. So in the case of emergency, they have to send somebody on a motorbike to travel to the nearest medical center to pick the medications that are needed to treat that person. So in the case of an emergency, we can see the extent of that whole thing. Okay. Another major current public health issue is the issue of what? Drinking water. I mean, a lot of drinking water, a lot of people do not have access to good drinking water, coupled with other environmental and climate issues. So extreme weather and soil depletion is affecting efforts to reduce malnutrition. It's affecting agricultural production. I mean, food safety and food insecurity has become a major issue in Sub-Saharan African region. Okay, and it continues to get worse. As I mentioned, water pollution. Okay, from mining and logging and all these things are creating significant problems. Overcrowding in both in public and in homes. Also making the spread of diseases and illness so prominent. Okay, and the sad part is that women and children bear the brunt of all these, since they are mostly the ones that are exposed in the homes. Another public health issue is lifestyle. Okay, lifestyle issues, and these lifestyle issues are really linked to poor nutrition, which is a major issue. The deal is inadequate nutritional foods for mostly the poor and those in deprived rural communities. And also, there's also the problem with overnutrition among the working class, okay, because of the adoption of a Western style diet. Simply because if you are working and you are earning a little income than the average, I mean, you feel that it is time for you to eat the burgers and eat the fried foods and all those, the fried chicken and all those things, which themselves are not that healthy. But unfortunately, that have been the lifestyle of the middle to upper income class, leading to many health complications like diabetes, hypertension, and a whole lot of other things. And another major thing that comes on top of my head is what? Poor sanitation, which is also linked to what? I mean, inadequate access to good or pipe-borne water, okay, leading to, I mean, major and perennial outbreaks of malaria, cholera, and other infectious diseases, okay. So the deal is, even though these problems or public health issues cut across all demographics, or, I mean, people of all backgrounds, there are significant variations, and these variations have created the inequalities and continue to worsen as time goes on. And these variations are between what? The educated and then uneducated, because the educated have jobs or relatively some income, and the uneducated do not have jobs and mostly no income. Between the haves and then the have-nots, okay? Those in rural versus those in urban communities, and between men and between women. So there are serious variations between these. And these have created a lot of health disparities and inequalities among people of all levels. But the unfortunate thing is that efforts to address these issues have been piecemeal, okay? They have not focused on addressing the underlying issues. And as I mentioned, the education that is being delivered in these regions are the ones that teach people to learn how to write and read. They are not the ones that advance innovation to address these complex issues that confront the average person in these communities. Okay, so to address some of these inequalities and to address some of these major public health public health issues, we need educational reform in the sub-Saharan African region. And education will be the foundation for all to address all these things. Okay, and for education, not just any type of education. We are talking about education that train people with skills to add value to the plenty of economic resources that are available to them. Education that advances innovation and entrepreneurship. Education that focuses on the needs of communities of society. Education that addresses problems, and not just reading and writing, which has been, I mean, the standard for decades upon decades upon decades, even though we know clearly that these things are not addressing any issue. And last of the last thing that I would like to talk about is education of the girl child and women. Okay, one philosopher, Dr. Agri from Ghana, made a statement, and he said, if you educate a man, you educate an individual. And if you educate a woman, you educate a community, okay? Meaning that, and research upon research have shown that when you resource a woman, or a woman is more educated, they are more likely to reinvest those economic resources and opportunities into their families and into their communities, okay? And their families are talking about their children, whether they are male or female. So to address some of these inequalities, I mean, we get the basic is to start educating, making the education of the girl child a priority, and giving women the economic resources so that they can reinvest into their families and their communities. And gradually, we will begin the foundation to address some of these major issues that confront us in the region. So I think I've talked too much, so I think I'll end here and then wait on for some questions and other discussions that may come. Thank you very much.
Thank you, Mathias and Odile, for those wonderful presentations. Very compelling discussion on the importance of the foundation of both economic, health, and gender inequalities, and of course the intersection thereof, right? And that's one thing that is often lacking, is that the intersectionality, that, you know, where does it all stem from? And also your point about women and education, right? Women, typically speaking, are the vortex of the household, right? And then all those decisions and influences, right, have all these repercussions that we often don't consider or think about, or address, I should say. So as a follow-up question, if you don't mind, Mathias, I was wondering, so you mentioned the importance, of course, of education and how that leads to all these inequalities, impacts on population health, individual health, access to care, and things like that. Have you seen, or has there been a transition at all in Ghana over the years that have addressed these issues, or there's still, you know, I'm guessing there's still pathways, or a lot of pathways to go, given how much they spend on GDP, or is there any type of movement on this, I should say?
Yes, I mean, thank you for the question, Maris. There have been, I mean, efforts, and not just only in Ghana, but I mean, if you look at the Sub-Saharan African region in general, countries are making efforts. So let me give you a typical example. About 15 to 20 years ago, because of some of these public health and health education issues, Ghana started a national health insurance program. And one of the main components of the national health insurance program is to provide free healthcare to pregnant women and their children, newly born children, so that right from the get-go, most women that rely on herbal medication or that have to wait till during their last trimester before they go see a physician will have the confidence to go to see a real physician, not just any quack doctor somewhere, to set the ball rolling for better health for the woman and then the child. So efforts have been made, but then the problem is due to low reimbursement rates and due to, delay in reimbursing these providers, these days a lot of, private hospitals and private clinics don't even want to take the national health insurance card. Okay, and so efforts have been made and countries are coming up with policy to address some of these issues, but the whole thing comes from funding. The whole problem comes from funding. The ability of these countries to resource these programs so that they can achieve the desired outcome that they want. So yes, that was
okay. All right. And then I also have a follow-up question for Odile. So when you talk about measuring occupational prestige, again, I noticed or I talked about how I personally also am working on that. We know that there's various scales to measure that and rank prestige scores. There's a Nan Powers-Boyd, Duncan, at least in the US that we use, and I'm assuming worldwide as well, NACOA and TREJ. Which prestige measure or ranking did you utilize for your study, or did you do a comparison, or how did you measure prestige, I should ask?
Thanks, Iris. So so from an economics perspective, we would largely just use the wage rate, right? And I must be honest, I haven't done any research on occupational prestige. I think that comes from sociology, right? If I'm not, yeah.
No, that's correct, yes.
So what I sort of did was I sort of tried to build a decent work index, which would include various sort of measures. But the problem that I had was I used secondary data, so I could only use variables which were available in the data set. So things like the wage rate, but in addition to the wage rate, looking at other sort of job benefits. Okay. So that's sort of how I ranked it. But
okay,
yeah,
because I thought you said you had you assigned good as 1 and bad as close to 0 and things like that. So it sounded like, so sorry if I missed that, but it sounded like you created your own occupational prestige score in a way with all those found. Okay, because I don't know if you have any measure of occupation. Do you have in your data sets, is there any type of thing that indicates that this is your occupation, like you're a CEO, you're an economist? Is there any type of data on that or not?
Yes, so I use I don't know if you've seen the international classification of occupations, where there are sort of 8 overall categories, where you have legislators, community workers, and then within those you have so maybe that'll be 1 to 8, I think, or 1 to 9, and then you have 0, and then within that you have 111 would be chief executives. So I use the 2-digit level. So I actually had in my data set I had 27 occupation groups where people would, so basically with the labor force survey, they ask people, what do you do? And then they sort of slot you into those. And then you also, it's sort of so if you're a domestic worker, you have a certain code, but then you fall into the cleaners and helpers category. So the level I just used was the 2-digit level, but it was the international classification ranking. Yeah.
Okay, perfect. Thank you so much. Are there any other follow-up questions, or because we have time to discuss, we have about 15 minutes or so, and if you do have a question, either you can put it in chat or you can raise your hand to ask. So any questions from the audience or co-presenters? Jacob?
Mathias, I really enjoyed your presentation, and Odile, I enjoyed your answers. I got here late. Sorry, I'm in California time, so my bad. I definitely kind of want to get into, because I've done some work with Iris on occupational prestige, so I don't have as many good questions for you, Odile. Mathias, I was wondering if you could just go into a little bit more in depth on maybe some of the incentives that might be helpful for educating girls. I mean, that last quote you shared was just super powerful about educating a community. And but I just saw the kind of contrast to what you kind of mentioned earlier on, just that when domestic activities are calling, it may not even be the girl's choice whether to get that. And so I was wondering if there's any study there as to how you can, I don't know, incentivizing probably the family to make sure that girls have more opportunity.
Good, thank you very much for your question, Jacob. I mean, the deal is things are changing. I mean, let me put it that way. It is not where as it's supposed to be. Okay, I mean, still as of today, due to cultural beliefs where they place the male child above, I mean, the girl child. I mean, still the women are still pushed, relegated to the background. And of course, as I mentioned, domestic demands are also pushing that. So the incentive here, or the what needs to be done, is more of an education. Okay, education not to the girls, but then to the parents to understand the need of some of these issues. Because the idea that it is the male child who will grow up and come and take care of me in the event that I'm old and I don't have the resources to do anything, I think needs to change. Okay, because if we have programs or policies that address some of these issues. So let me give a typical example. In Ghana, for instance, if you don't work in the formal sector, you don't have any pension, you don't have any income, any social security or anything of that sort. And close to 70% of the population do not work in the formal sector. Okay, so some of these parents are banking their hopes or their social security on these on their children. So as a society, as countries, if we can have some policies that will address some of these issues, that is forcing people to believe that it is the male child that will come and take care of me, rather than the girl who is going to take care of her family and her children, I think we may be able, maybe an incentive to address some of these perceptions that we have that is, I mean, hurting all of us in the long run. Okay.
Oh, totally. That makes a lot of sense. No, thank you.
Thank you.
I also have another follow-up question, Mathias, about this topic related. So you mentioned that there's an issue of self-medication, right, for those in Ghana. Have there been any studies specifically on the impacts of self-medication on like quality of life or mortality, you know, measures and things like that, so that that information can then also be utilized to say, you know, this is another issue that we're addressing, right? So if we have, or if there's more research out there, right, those can help with the public policy formation, correct?
Yes, good. Thank you for your question, Iris. Those research are now coming because these issues, even though they have been there for a long time, people are beginning to be aware the existence of some of these problems with the help of social media and with the help of, technology and everything. It's making it clear and clear. The problem when it comes to self-medication is that it's a very complex issue. Okay, since access to medicine, whether prescription drugs and all those things, are so easy. Okay, it's so easy to get access to. Antibiotics, so easy to get access to controlled substances, so easy to get access because you just walk to the drugstore and you said, I want to buy it. If you provide the money, you're going to get it. So it's a major issue. So these days, people are beginning to be aware of some of these problems, but the issue is the underlying problem have not been addressed. So there's so much research opportunity for some of us to look into to get data how they have affected people's quality of life and health outcomes, and a whole bunch of other things that needs to be addressed. Because if you look at the current death statistics, I mean, a lot of people are dying of kidney failure and liver failures and all those things. For the past 10 years, I mean, it has increased astronomically. If you look at the data from the Ghana Medical Association, Ghana Health Services, it has increased astronomically. And so there's something wrong with the way people self-medicate and people do things on their own that needs to be taken care of. Yeah.
Right. Perfect. Thank you. I do have a follow-up question in the chat, so I'm going to ask that. Is education, which actually means schooling, a solution or problem in modern times? The question must be raised because the problems, inequality and poverty have been created by people who are highly educated.
Thank you so much for that question. I think it is either way. Okay, it is that way. But then on the flip side is that when the people are educated, it is less likely for the few that are educated to cheat them, or in other words, to create the problem for them. Because if you look into the Sub-Saharan African region, the few that are, the educated ones are the ones that are running government, I mean, corruption and all those, and those are the people that are, I mean, taking charge of all these things. So the education here that I'm referring to is the one that empower people to understand their circumstances, empowers people to understand the economic resources that are available to them. And the ones able to tap into that, of course, innovations will flourish, entrepreneurship will flourish, and people will be more educated about the things that surrounds them, and therefore they'll be able to question government policies and government and other public issues that affect them and their children. So in the end, even though current education is creating some sort of level of a problem, it is hoped that when the masses are educated, we'll be able to address some of these issues. Thank you.
Right. I also have another question for Odile. So our question is that, standard ideation status, that is occupational prestige, tend to be quite Eurocentric. Does this significantly affect categorical ranking for the global South? And if so, how does your ranking reconcile the bifurcation? These are big words for me. Also, would you reckon that social reproduction theory would be useful for empirically looking into unproductive labor in analysis?
Thanks for that question, David. So yeah, on the occupational ranking, so this is like a general problem that we have, for instance, with the labor force survey. If you look at the difference between the unemployment rate, our official unemployment rate, and our expanded unemployment rate, which in most countries there isn't like a big difference, right? But because we sort of follow these international standards, we end up how do you say, underrepresenting or underreporting the issue, right? Because like I said, you know, the difference between our official unemployment rate is 35% versus 52% if you include the expanded definition. And a lot of researchers who do work on the South African labor market have written about how inappropriate using the ILO's official unemployment rate is for a country like South Africa, where there's such a big difference between the official unemployment rate and the expanded unemployment rate. And I think the same things could be said for workers who work in the informal economy, right? So traditional sort of labor force surveys, well, we've made a lot of progress in that now, but in like just a few years ago, it was very difficult to sort of enumerate informal workers. The same goes for agricultural workers. So like, I think there has sort of been a move towards sort of tweaking our labor force survey, although keeping in line with international standards, because we want to compare everybody to everybody. There is sort of like a move to tweak the way we do our data collection and the type of data we collect to sort of you know, talk to our context, but also then to, go along with the rest of the world, which we need to do. So yes, I do think the occupational ranking would be Eurocentric in that sense, because the list of occupation groups available would come from the international classification. This is also why I like time use survey data, because it doesn't just sort of ask us what you do for money, or we're literally just asking what do you do with your time. And these studies that have shown that, the way people answer the questions in the labor force survey, sometimes they would answer it in a way where they get classified as unemployed. But if you go look at time use survey data, you'll find that actually these people do some work, but because we use certain standards, like saying, I know there's a question where we say, have you done work for at least a certain number of hours, whether it be 4 hours or 8 hours? So it's like a sort of a very arbitrary thing. And if you've done more work than that, and then boom, we consider you as employed, or boom, you become a full-time worker versus a part-time worker. So some of these things are like very like arbitrary. And like for me, the time use survey just sort of gets us past that, because then we're literally saying, okay, just tell us what you're doing. And then based on that, we can see, okay, this is what the person is actually doing with their time, versus using these sort of very Eurocentric, definitions of things that we've been following. And then how does my ranking reconcile this? I'm not sure it does. Maybe that's a limitation of my study. Because I use the occupations that are available there. And I suppose the reason why I do that is because the point is that I wanted to show that it was insufficient. So that's why I said I'm using the decent work framework as they are telling us to use it, to show them that it doesn't work if you take into account these other things. So if you take into the account the unpaid reproductive labor, then it shows that this scale that we're using here is insufficient, because then women are never ever going to have decent work if this is how we are defining decent work. So we do need to find new and better ways of thinking about these things. And then social reproduction theory, yes, absolutely. I think that's sort of this is the premise of what social reproduction theorists do. Although they do take a bit of they take their cue from Marxism, right? I'm scared of Marxists, I'm not gonna lie. So I steer away. But yes, social reproduction theorists, definitely the way to go.
And
Thank you so much. Thank you.
Okay. As a follow-up to that, Barbara asked a great question, if you don't mind, Odile, is that, or a comment about this, I would say, is that in regards to the subordination of migrant women and women from minority communities by outsourcing housework, there could be a study of whether these women do improve their lives and the lives of their families by having work and income, thus reducing inequality for this group, or how inequality could be reduced given the situation. So just as a follow-up, I don't know if you want to comment on that, but just, I think this is a great suggestion, Barbara.
Yeah, absolutely. Yeah, although we would need to consider, what those women are actually getting, because sometimes, getting into the labor market can be empowering. Sometimes it's just, another form of reproducing exploitation, especially like in low paid jobs and so on. But yeah, definitely. I do think we need more on migrant women, and I suppose they are more difficult to enumerate than, sort of people who are more visible in the labor market.
Mm-hmm. Yeah, and I think this also ties into another question that was asked in the chat, and this is probably for both of you in a way, right? Is that how do we improve educational opportunities for all, right? So as the individual pointed out, sorry, I'm really bad at pronouncing names, so I'm not going to try. We are all suggesting to improve education opportunities in society, but we do not tell how the constraints of universal education can be removed.
Okay, yeah, I'll comment on that. And it's true, and I completely agree with you that the constraints of universal education is a problem, especially in the global South. The inability to have access to primary and secondary education creates a significant inequality or creates a barrier for people to succeed. So it's the major thing that I think the region or countries within the global south, especially in Sub-Saharan Africa, needs to look into. Okay, but beyond that, also other issues that we can also needs also we need to also look into. So I give an example for Ghana. Okay, in Ghana, K through 12 education is free. Okay, at no cost. But the problem is, if you don't have the school in your area or in your community, how are you going to have access? The education infrastructures are not there. Okay, so for instance, like I said, we were in a rural community sometime in January 2019 in Ghana, and there were some about 6 or so different rural communities that did not have any a school. Okay, they only have one school building, one of the villages that all the children have to walk, sometimes about 5 miles, 6 miles to that particular area. And when we went there, there was one teacher that is responsible for K1 through K4. All of them, they've combined all the 4 classrooms, all the 4 classrooms into one and teaching them. So you can, deduce from it that even though education is free right from the get-go, the infrastructures and the things that needs to educate the people are not there. So that also comes back to what? Making sure that these policies are resourced by the countries with enough funding to achieve their desired outcomes. Yeah.
Wonderful. So as we wrap up our session, I was going to ask, and by the way, again, thank you so much for both our presenters. This was absolutely wonderful. I was going to ask, Mathias, what are your next steps for this project, for your research, or just in general? And same with Odile. Do you have next steps? And what are you looking into further?
But Odile, do you want to go, or do you want me to go, Odile?
Either way works. I can go.
Okay, ladies first, go.
Okay. Perfect. Sorry, I just wanted to add on the education question that education is like a public good, and I think like we need to start treating it as such, especially tertiary education. So a few years ago we had the Fees Must Fall protest here, which was essentially students protesting against barriers to access in higher education. And I know that these have happened elsewhere in the world, in the UK as well, where people are essentially saying, this is like a basic human right, we shouldn't have to pay for that. And the flip side to that is having compulsory primary and secondary education, which the government can easily legislate. I think we have that, if I'm not wrong. But I think what's also important is like the quality of education, which is also an issue here by us, because you sort of have people who are sent off to private schools, and then these people sort of go off to Oxford and they go off to Harvard, and then they come back and they write our policies for us. So you are right, a lot of these problems are created by educated people. But also it's about sort of social indoctrination is a big part of the educational experience, and I think that's sort of like what we're missing, and that's really where quality education comes in. So just quickly, a few weeks ago, I was sitting at a restaurant and these teachers had brought, it looked like a grade 1 class out for school, and they sort of do these lines of boys and girls. I'm sure you've seen that. It's like a very old school thing now, but there are still schools who do that. And so that sort of like reinforces, sort of gender differences between boys and girls, essentially, that we then carry over as adults. And I think Iceland has been very good at, having activities that show boys and girls, both can do both things, so boys can do things that girls do and girls can do things that boys do. And it seems silly, but if you then grow up to be an adult and you have to decide between whether your boy or your girl is going to school, and you choose your boy for whatever arbitrary reason, this is sort of like the foundations that it comes from. So I think, beyond just like basic competency, we also need to think about, the sort of social norms that children are taught at school, and like the sort of community people that they become part of our society. What sort of citizens do they become, when we teach them those things at school? But in terms of the way forward, so yeah, my research going forward is sort of looking into the black box, which is the household, and I've become sort of more interested in studying how people share their resources in the household, because in South Africa, at least a lot of the research that we have on households tell us a lot about, the dynamics between men and women who are married. However, marriage rates are falling, and the nuclear household doesn't really exist in South Africa. So a lot of our households are extended households. My household, for instance, is an extended household. I have my husband, my child, and then I have my brother-in-law living with us because he's unemployed. So we are sort of like the norm in South Africa we are sort of carrying the burden of labor market failures. And also very few fathers actually live with their children in South Africa. So that adds then additional burden to women. And then of course we've got the growth of the female-headed household. So I'm not sure, like my ideas are still sort of all over the place because there are all these different dynamics. But there's also, like, society's changing, women are getting access to income. So, we don't sort of like follow the rules that our mothers and our grandmothers used to follow anymore. So like, how does that, change the way we then negotiate our time and our money in our household? So that's sort of where I'm going out of the economics box, I suppose.
Okay, thank you. On my part, I mean, you can see that the issues that confront the Global South with respect to health inequalities and public health issues are too broad. Okay, it is not something that we can just put it together into maybe one research component of that. So the way forward is to look into various pieces of these issues or these factors and address them. So for instance, a paper that I work with my colleague, Mickey, is about electricity and its impact, electricity access, and how that impacts health and health outcomes in rural communities in Ghana. So what you're doing, a way forward is to to chip pieces of it and seek to find solutions or things to find a way to address these issues, to disseminate this information so that people will understand or know how to address or how to approach some of these issues. So yes, the way forward is to take each factor and within each factor go into sub-factors and address them as we move forward. Thank you.
Again, thank you so very much. That takes up all our time, sadly. I think we could go on and discuss this for a very long time, but thank you so much. As a reminder, this presentation will be recorded, or has been recorded, I should say, and will be posted to the ASE YouTube channel and in a couple of days, or actually in a day or so. So again, thank you so much. Thank you for our participants, all the great discussions, and especially to our panelists. So hope everyone has a wonderful day and stays healthy. Thank you.
Thank you. Thank you.
Bye.